Good morning. Joining you once again from Academic Alliance in Dermatology, where this morning it's all about lasers. We're kind of diving in and talking about why this is such a popular treatment that people are doing, not only for this doctor right here that we're getting ready to chat with, but all of the offices within the group as well. This is something that's expanding. And again, we are chatting with Dr. McMeekin this morning. Good morning.
Good morning.
Let's talk about lasers. I know this is something very passionate and something that you've really championed here in the offices too, but from what I understand, the company-wide, you have offices all over the Bay Area. This is growing rapidly for you and the team.
Yes, it's been very popular with our patients. We have 18 offices, and 3 of the offices now have lasers. At Kennedy, we have 4 lasers, another office over on Kennedy Street. Here, we've just added a second laser to this current one, the Candela Elos laser. Each laser has very specific things they can do for dermatologic conditions. So if you have hair removal, you need a specific wavelength that treats hair. If you're treating psoriasis, there's one that treats the blood vessels of psoriasis. And this one here treats wrinkles or photo damage on the face. And the one that we just acquired treats blood vessels and pore wine stains.
You know what I love about you and your team here is you talk about the different devices, the different technology that's being used, and maybe people do have a choice in who they go see to use those treatments, but it's really the team behind that as well that I think that is just as important. I want you to talk a little bit about your experience too. I know you champion for a certain laser to be brought here in the office, but your experience is really not really comparable, I think, to other maybe places in the area. Why is that important, do you think?
Well, I actually can trace my laser interest back to my undergrad days when I was taught by the Nobel laureate that invented the laser and got a patent on it. That was shared by Arthur Shallow and Charles Towns. And that kind of stimulated me. When I got to internship, one of my mentors was starting lasers, Ken Arndt. And one of the founders in dermatologic lasers was Leon Goldman, and he's a founding member of the American Society of Laser Medicine, which I'm a fellow of. And so this academic interest is kind of carried over to the Academic Alliance, where now I teach the other providers, including the nurse practitioners and the doctors, about the various nuances of how to select a laser for a specific problem.
Because again, I think you hear about lasers a lot, but it's just important that you have the right person conducting the treatment and using the machine, correct? Why is that important that not just anybody can do this?
Well, it's like the old adage, if you have a hammer, everything looks like a nail. And so we have expanded our use of lasers so that we have specific lasers for specific indications. And knowing what to treat and what not to treat is very important.
Yeah. Do you think this is just going to be a trend that continues into 2020 and beyond, where we're going to see more of these laser type treatments and the specific things that they can help deal with?
Absolutely. Coming down the line will be a cure for acne that involves laser and probably a chemical device. I've seen early studies from Harvard that show very promising results. And there'll be other lasers that treat things that we can't think of treating now that are very difficult.
I would imagine so. You also have something coming up. Again, this is why we love partnering with you and your team, because it's all about the education and letting people know, maybe think differently and on different things. International Women's Day is coming up. And once again, your team is putting on a great event, so maybe people can come out and maybe hear about some of these things, learn some new things. Why don't you invite everybody out? I know that they had to move locations because it's backed by popular demand.
It's been very popular, so we have a bigger facility. This is March 5th, and we'll talk not only about lasers and the technology we've expanded here at the Academic Alliance, but we're going to talk about cosmeceuticals and other things you can do to enhance your appearance.
Yeah. Doctor, thank you again so much for your time this morning. We appreciate all that you're bringing to the Bay Area as well in the technology and the experience with lasers. If you have any questions, certainly you can call them today. We're going to put up their information as well, but make sure to check out that event too.